Our next panel is on understanding Gen AI in healthcare. It's going to walk us through some real-world case studies, exploring concrete examples of how Gen AI is being used in healthcare. This panel is being moderated by Dipty Desai, who is a board member of the IITBAA Area Alumni Association. She is the CEO of CareAsOne and also the president of the HIMSS North California chapter. She is a very active member of the IIT Bay Area community, and she's well known for her passion about bringing community together and healthcare. Welcome, Dipty.
Hi, everyone. We got mics. Everyone's mic'd up. So thank you, everyone, for joining us today. Really looking forward to getting to this conversation of Gen AI in healthcare. And as you know, Gen AI is very pervasive, high adoption rates, and it's offering quite unprecedented opportunities to improve patient outcomes and operational efficiencies and drive innovation. So in this session, with these healthcare CXO experts that we have over here, we will be sharing some real-world experiences and insights on how Gen AI is being deployed in healthcare. They will address not only the opportunities that exist out there, but also some of the challenges that can be faced. And they will help us decode the future, which is the topic of our conference. And they'll help us with some practical strategies and best practices that are powered by Gen AI. So before we begin our session, I'd like each one of us to introduce ourselves. Each of these are really highly accomplished people, and they have like a list of accolades that go down a couple of pages. But in the interest of time, we will keep our introductions to like 1 minute. If you can just tell us a little bit about who you are and what you do in a minute. And then, of course, the audience can get to know them a little better later after the session. We will also want to keep this interactive and want audience participation. So I'll start off with a few questions, but we would love to get your questions too. So without further ado, let's do the introductions, and then we'll get into the questions, and we'll expect you to interact with us. So get started then, Khalid. Thank you.
Yeah, good afternoon. Thank you, IIT Bay Area, for having us today. My name is Khalid Turk. As a work, I'm the Chief Healthcare Information Officer at the County of Santa Clara. And as a professional, I've been in the industry for many, many years. I wouldn't even age myself, but in healthcare for about 25 years. I am a published author, and I've been in leadership and consulting roles for many, many years. If you want to know more about me, you can follow me on LinkedIn, or you can find my website, which is my actual name, khalidturk.com. Thank you.
Thanks, Khalid.
Hello, I assume you all are interested in healthcare because you're all patients. You aren't professionals in healthcare. So hopefully you find this interesting. I'm John Squeo, Senior Vice President and Business Unit Lead for Citius Tech. Those of you who don't know Citius Tech, we are exclusively focused on healthcare information technology here in the US, and based in India, Mumbai, Hyderabad, Chennai, Bangalore. And so 75% of our workforce is there, 25% here in the US. I've spent most of my career as a CIO for large health systems, putting in EMRs, and so I've taken that now and trying to really drive conformity and interoperability and really driving the value out of all the digital data that we've compiled with EMRs. So, pleasure.
Good afternoon, everyone. Great to meet you all. I'm Amar Dixit. I'm the Chief Medical Informatics Officer at San Mateo Medical Center. San Mateo Medical Center is the county health system for the county of San Mateo. I'm also a practicing physician, extremely excited to be here and appreciative of being able to share this avenue and venue with all of you guys as we delve into this really fascinating topic and have some good discussions.
Thank you.
Thank you. I'm Vinny Liu. I am Chief Data Officer at the Permanente Medical Group, which is the medical group that serves Kaiser Permanente in Northern California. We are the largest medical group in the country, made up of about 10,000 physicians. I happen to be a practicing pulmonary critical care doctor, which means lungs and intensive care unit medicine. So whenever I talk to people about where I work, I say, I hope to never see you there in the ICU. But I lead programs related to data science, our data and analytics workforce, responsible AI, and I'm also an NIH and nonprofit funded researcher and we look at AI and ML applications of EHR data to improve patient outcomes. Thank you.
Thank you. Hi, everyone, and I'm Dipty Desai. Many of you may know me. I'm the board member of IITBAA area, but I do wear multiple hats. I'm the CEO of CareAsOne, which is an organization that brings all the verticals in healthcare together, from payer, provider, pharma, med devices, clinicians, academicians, startups, investors, and more. I also am an AVP at GAV's gslab that creates solutions, services, and products in healthcare. And of course, I'm really excited that we have this amazing panel over here today. So let's dig into the panel. I know many of you, all of you probably are in technology, right? So raise your hands if you're in technology. Yeah? Yeah, literally almost everyone. It's IIT. And how many of you are interested in doing something in healthcare or interested in healthcare in some way or another? Quite a lot of you, so that's good. We're really looking forward to some exciting questions coming from your side too. But to begin with, I will just start it off. So John, let's start with you. You are a senior VP at Citius Tech, and you work with providers. And by providers, I mean health and hospital systems, for those of you who don't know that. So as you're working with these health and hospital systems, what are the criteria that you use to decide whether Gen AI is right for their strategy, for that organization strategy and digital technology, or whether it's not? Like, can you just elucidate?
Absolutely. Well, I think my physician colleagues might agree that the Hippocratic Oath has a core tenet, which is first, do no harm. And that means that safety and risk, and of course privacy as another part of that, are paramount to everything we do that might be unsupervised from a human being, particularly a human being that's licensed expert. So based on that, a good way to dip the toe by a lot of healthcare organizations has been on non-clinical activities. And so risk reduction is a key paramount tenet. One of the ways they've done that is find a huge amount of burden in administrative tasks, and particularly ones that just really don't contribute to keeping people well. It's the paying the bills, it's what we call revenue cycle management, and particularly in this almost arms race between the health insurance payers and the health providers in the billing and negotiating rates. And so we've seen a huge amount of benefits when we focus on that. So I think that the first thing is get something that's low risk, that you're not going to hurt anybody, and that's going to have a huge impact that will then be able to be refueled into further innovation and investment. Move on to clinical tasks as we really become experts on that. The second thing I think is stakeholder engagement is critical. Oftentimes the genesis of these are either in the innovation department, maybe in some R&D, but oftentimes it's tasked to the CIO or the CTO, or the CMIOs are on the critical path to that. And in fact, in order to really drive adoption, I think we heard it very early on today, that if the humans don't use it, it's useless information, it's useless technology, useless investment. I think the core tenet here is early stakeholder engagement of the actual disciplines. If you think of Miller Heiman, it's the actual user buyers, the people that are running the service lines, the business lines, the clinical leadership. Because if they don't say, hey, look, this is something we would actually do, and here's the criteria and the stage gates to get there, then you probably shouldn't do it. And a centers of excellence is a great model of governance to try to get that and achieve that.
Vincent, you come from the healthcare system side of things. Can you add anything, and what is it that you would use to?
I would love to talk about one of our applications that's now been used millions of times, or our partnership with a company. That company is a bridge, and what that does is ambient AI documentation. Many of you may or may not know that the clerical burden of documentation is crushing clinicians. It is brought up as one of the most common reasons for burnout, one of the most common reasons that nurses and doctors want to leave the industry, and burnout is at an incredibly high rate in physicians, 50%, probably similar in nurses. Ambient AI allows for a microphone to capture a conversation between a patient and a provider, do the documentation in real time, and then use generative AI to then summarize that into a note format that is very similar to what a clinician would normally document. And what does that allow? That allows the reduction of cognitive burden and really clerical documentation burden to clinicians. But even more importantly, it allows the EHR not to come between this really important relationship between two humans, a patient and a physician. We've seen really exciting uptake from our clinicians, but really also maybe some of you have been in interactions in which this unobtrusive technology is being used. It's safe, it's secure, it is low risk because the clinician goes through, gets permission, and then ultimately edits all of those pieces of documentation.
That is so true. 40 years ago, we had that dragon, naturally speaking, and it's evolved, and now there's so many scribes out there. A bridge is a really good one. And Vincent, you are the Chief Data Officer for Kaiser Permanente, one of the largest group of hospitals. And you have about, what, 10,000 physicians and about maybe 50,000 nurses over there. And you're right, you can't have them burning out. You really need each and every one of them and maybe more, right? So how do you and your team assess whether a technology is right to adopt, both technically and also culturally, right? You need that fit to happen. So what is it that you do to make it happen?
I mean, that's a great question, and I'll speak from the heart here. I mean, I want to make healthcare more human, not to put more machines between patients and their providers, more agents, more technology, but leverage those technologies in a way that brings the human interaction closer, more effective, more meaningful. Because as you all know, as we all know, healthcare sometimes gets in the way of us achieving health. We all care about health and well-being. We don't care that much about healthcare. So AI, that's how I'm kind of thinking about AI tools. Some of those are in the back office. Some are in the, in the clinical tasks. Some are going to be patient-facing because we're seeing incredible capability. But anything that can draw us back to a really meaningful and effective human interaction, preventative, proactive, effective, empathetic, and ideally equitable, those are some of the dimensions about how we're thinking about those tools.
Khalid, you want to add something about readiness and whether the technology and the culture is right fit for your organization?
Yeah, that's true. I think before even I come to the question, I want to say something. There's this old English saying that if all you have is a hammer, everything looks like a nail. So right now, the talk of the town is AI, and with the AI, everybody, where I can fit in that AI. So I think this question is really relevant right now, that is your organization ready? And when you talk about the organization readiness, there are two aspects of that. One is the technological readiness, infrastructure readiness, and second one is cultural readiness. Obviously, AI is challenging. The way the EMRs challenge your status quo of the doctors. I started, Dr. Lou, with Kaiser Permanente many, many years ago when they were rolling out the EMRs. And initially, there was a huge pushback. I don't have time to document. But eventually, we come across, and we are talking about the area like Average, as you mentioned, that how we can piggyback on the ambient clinical voice. So when we have these opportunities, we have to make sure that change management is very important, and change management is not in literal sense when you are putting a piece of software in production, but change management from the true organizational sense. Are your people ready? Do they have the proper tools, proper training? And if your infrastructure is ready, not only from the scalability perspective, but also from the security perspective. Healthcare is one of the heavily regulated organizations and industry, basically. So we have to make sure that by introducing AI, we are not compromising on the data security and privacy. So these are the elements that I would consider when I talk about the organizational readiness.
So true. Healthcare is so heavily regulated, and everybody thinks it's slow, but it is slow because of so many checks and balances that need to be taken care of. And yet, every one of us uses Gen AI to diagnose our own problem at home. How many of you have done that? Yeah? You just go and say, oh my God, I have the answers, but it's not that easy. So it's interesting. Khalid is the Chief Health Informatics Officer at Santa Clara County Health, and he's constantly evaluating technology, buying technology, building technology for his organization. Khalid, what kind of criteria do you use to evaluate Gen AI vendors, people who are selling these solutions, these services, the products that they have?
Yeah. One, that social advice I would have for the audience, especially those who raise their hand, that they have hands rather, that they are interested in healthcare, that you have to put the FOMO on the bay, fear of missing out. Nobody's missing out. Healthcare is slow, so you'll get your opportunity. And the reason it's important that we just don't try to put a square peg in the round hole, because that is one of the challenges. So when I'm looking at the providers of the AI, or whether they are startups, there are some established companies that are venturing out in a different realm. One thing that is very important for the healthcare is that it is driven by one piece of software that we all call EMR or EHR, electronic medical record or electronic health record. So it happens in America that this particular field has a domination from at least 2 players or so. Everybody, most of the people who can afford use Epic, very few use Cerner, Meditech, and few other very small companies. So the first step when we go out and look at the AI is to ensure that that solution either is provided by that particular vendor or actually can integrate well. Interoperability has been the key challenge in the healthcare for years, and we are getting somewhere with the advancement of technology. But with AI, if you just bring in some new startup and put on the top of your EMR or EHR, as you call it, it's the same thing basically, then you have a challenge, again, with the interoperability. Who is doing that? There's also another saying that if a healthcare company is being run by a technologist, it's a technology company, not a healthcare company. So let's see that who is running it. If it's a doctor on the board, if the doctor is in the cases of some of the recent startups in AI, if a provider is on the board or a owner or a founder, that is a huge plus because they are coming from some point. They understand the business. Average is in that case owned and operated by a provider. Hippocratic AI is also run by a provider. So these are the companies which actually have come from the pain, whether it's a burnout or the cognitive load that the doctors are facing. So that is an important contribution. The first one was the interoperability with your existing EMR. The number one, who started the company and who's running it? What is their vision? What is their approach and understanding in terms of data privacy and security? And last but not the least is the scalability. Is there a scalability in the solution? If you are starting, even with the pilot that we do with most of the AI solutions, we start with a handful of doctors, but then we have to scale, in some cases, in Dr. Lou's case, tens of thousands of providers. Can the solution scale along with your EMR? And if answer to any of those questions is no, we would rethink about adopting that particular solution.
So true. Viability, scalability, important when you're evaluating vendors. Amar, you wanted to add something to this?
Sure. I think Khalid hit all the major points there. I'll kind of look at it in 3 different buckets, right? The who, the how, and the what. The who, as Khalid was mentioning, matters a lot. I think in a lot of areas, you think that you have expertise in one discipline, and you can carry that expertise, and you have a playbook, you know how it operates, I can go disrupt something else. And we've seen the biggest of players. We've seen them come together. We saw the JP Morgan, Berkshire Hathaway, Amazon. They came together, couldn't solve it. We saw Walmart come in, couldn't solve it. We saw Walgreens come in, couldn't solve it. I could go on and on and on. And oftentimes, this is because the who are folks who do not necessarily have the expertise in that particular area. Now, with that said, physicians or a nurse or other clinicians may not necessarily have some of the other expertise that's needed to sort of bring that technology solution to a healthcare provider or healthcare system. So when I say the who, I often look at who is leading this company. I look at that. I look at what's their background. I actually look to see who are their clinicians. Do they even have any clinicians? And sometimes, surprisingly, the answer is no. And I know if the answer is no, when I come to have those folks talk to my people, when I have them come present to my committees, they won't even know how to answer some of the follow-up questions. We may have to have a shared language. You've referenced it right over here, EHR, EMR, right? My expectation is that when you come to my health system, I shouldn't have to explain to you basic terminology around medical care. And that should be because, one, either you've learned that, but even more likely or even better, the partners you have running your organization have an understanding of the clinical care. So that's the who. The how was around the EHRs and EMRs that he's referenced. Every healthcare system is investing hundreds of millions of dollars, sometimes billions of dollars, in their electronic health record. This is by far their largest investment and definitively their largest IT investment that they're ever going to make. For example, we are going on an Epic system in 2 weeks, and we've invested hundreds of millions of dollars. It's by far the largest investment we've ever made, and it's going to be the largest investment we've ever made. So when I'm looking at how your technology solution is going to fit into what I have to offer, I have to make sure that it works with my biggest investment. It has to have that integration as Khalid is offering and discussing. Now, the what is always an interesting question. Your solution that you may bring to me may be better than the solution I have today. It may be 20% better. It may be 40% better. But that may not be enough to move the needle. It's because you may be offering just one single solution. And I think the previous gentleman who was doing our lightning talk talked a bit about platforms, right? Oftentimes when you're bringing a solution to me, I'm going to be looking for more than one thing. Occasionally I may be looking for a single thing. And the reason I'm looking for more than one thing is it can solve multiple problems of mine. And when it can solve multiple problems of mine, that means I have a lot less maintenance burden, meaning that I have to assign less IT resources to maintain that software. I have one solo point of contact to work with. I have one less API to maintain and to ensure it's working effectively. So I'm often looking at not just the best solution, I'm looking at for the solutions that fit one into my system and what can offer a variety of and solve a variety of different problems.
Can I layer on one dimension to that too? I think the other portion of ability to solve unmet needs and address pain points is also cost sustainability in the long run. If we look at the application stack and catalog of a lot of the health systems, you can really define them across and say these are fixed costs, EMR, CRM, ERP, HRIS, the Workdays, the Infers of the world, Epic, Meditech, Cerner, Salesforce, Dynamics, whatever. But then you can say, those are kind of table stakes, but then you can say, what about all the other stuff that we want to do? The analytics, the connective tissue, the interoperability, the additional buy-up. Those are the ones I feel that I'm hearing from a lot of clients now. If we can't demonstrate a clear, very rapid return on investment with those, the discretionary income is really not there with the margins that healthcare systems have to really fuel that. So it's very interesting when you draw that line, I feel, and I'm curious to know, but if the scrutiny becomes much more poignant around the discretionary and variable than the fixed must-haves.
That's great. I know we've got this conversation going, but we really do want audience participation too. So if you do have questions, please line up over here, and I will ask the last question, and then we will take audience questions. So this last question is all about efficiency and gains. What types of efficiency gains are you trying to achieve by deploying GenAI in documentation or for administrative tasks or for clinical engagement?
Sure, I'm happy to take that. And I like how you sort of bucketed those in 3 different buckets, right? So they're the back-end tasks that Vincent was referencing before, where administrative tasks, we can make them more effective, we can be faster, we can be more efficient, use less human beings to do that work, potentially need less IT resources to do that work. When I think of the clinical care delivery, and it's interesting because it's called health care, not health providing, it's called health care. It's about caring for the patient, caring for all of you, caring for your family members, where you're at the center of care, right? You're the individual who's receiving, or your family member is receiving it, and surrounding that individual with care, right? I want to be able to think about the solutions that I'm offering primarily on that vertical. That's the first vertical I'm going to measure it on, and not always do solutions actually increase the quality of care that we're providing. I may give you more volume, but am I actually treating your diabetes any better? Am I actually making your hypertension any better in the long run? I don't know the answer to that. So I want to look at that. The other thing that I want to look at is what's my experience for my workforce? Burnout's a big deal, as we've been talking a lot, and that's why you see organizations such as Kaiser really leading into some of those Gen AI solutions, both around ambient listening and some of the documentation solutions that exist. The third thing I'm going to look at is cost. We've been talking a lot about cost. Is there a way for me to potentially generate more revenue, to reduce the amount of costs that I have with my organization? And the fourth thing, of course, is the experience that you as a patient are experiencing, and not just from a quality perspective. Interestingly enough here, I just listed off the quadruple aim. And hopefully here, if you're listening to a healthcare conversation, if you're going to enter the healthcare space, you got to know what the quadruple aim is. So it's a foundational piece upon which to think about the products that you're thinking about offering and bringing to us, and a foundational piece when you look specifically at Gen AI. What part of the quadruple aim are you solving?
Dipty, I would like to add some few things.
Yeah.
Excellent. I think I just provide a different perspective from the administrative. There's a patient care and administrative aspect. For the uninitiated, I want to share some numbers with you. If you didn't know already, the healthcare economy in America is about 18% of our GDP, which translates to 4.5 trillions. 4.5 trillions. You know, if you start counting, it'll be days. It'll be that kind of a money. And 18% and 4.5. What does it mean? We spend about $14,000 per year per patient. And that number may not mean anything until you compare with some of the developed world. Like Japan has 3,500 per capita expenditure that they have. Other advanced country like Germany spends around 6, 7. Australia is like that. UK has a different model, so I will bring them in this data. So when our cost is at that, our average life expectancy is around 77, which is the lowest of all the OECD countries, if you look at that. Like Japan has 85, even Germany has 82 and 83. Other Asian countries that developed, like South Korea, also has 80 plus. So when we are spending about $14,000 per capita in America, we are about average 10 years behind in the life expectancy. There are many variables involved, so don't get me wrong, but obviously healthcare is one of the very important driver of your life expectancy. And when you drive that cost further down, where this money is going, $4.5 trillion, it's bigger than budget of many countries, in especially developing world. 60% goes to the labor cost. If you don't trust me, you go and do the search on American Healthcare Association's research. 60% of those costs goes to your salaries and benefits and whatnot. So when I use the word efficiency, efficiency is not a magical word that you were, say, seeing 10 patients one day and next day because of AI you'll see 20. That's not going to happen. So we have to see and look at the cost, the major drivers of the cost, where we can enable the AI. For those who are technologically natured, when we are talking about the generative AI, we are talking about human in the loop all the time. Whereas many of the costs that happens, where is the human outside the loop, where we actually bring in the agents. I believe a lot of work needs to happen in AI, where we enable those cost-inducing factors in the healthcare and put the agents there, AI agents. Generative AI will bring some ease, solve some of our front-end burden, solve some of the provider burnout, which is very important. But there are major issues that need to be addressed. So if we are far from bringing the efficiency in healthcare with AI.
Someday, yes. I know we have a long line here, but maybe we'll take like 1 or 2 questions, and then there's a coffee break or a networking break coming up, so maybe we can continue with the questions at that time. So whoever's the first.
Okay.
I can't hear you.
So the question is for talking about security and privacy you talked about. Does a authority to operate from US federal government consider as a checkbox in your outlook when you look at different technologies? Like you put out some RFPs, but is that a factor that the US federal government has given authority to operate to a company that is providing an AI solution?
Can I take that?
Yeah, sure. Yeah, I was going to say.
Yeah, there is no particular mandate. I think the federal, speaking from my knowledge perspective, the federal and state policies are technology agnostic. Okay. They just basically state what needs to happen, basically for HIPAA. At the HIPAA, which is the driving policy for the patient information privacy, not necessarily security. Part of that deals with security. For security, we have other rules and regulations, is that judge states what needs to happen. Then it is a responsibility as a CIO of this organization. I have to sign the audit every year. So the CISO will actually conduct the audit. I have to sign that these are the factors that are meeting the HIPAA requirements, and we put this on the file. It is only readily available if the inspection happens. We don't have to report on regular basis to the state or the federal agencies. But if any of the breach happens, there are rules and regulations. We have to self-report, and if there's a self-report, there could be a penalty, but if we don't report, there's even a higher penalty. So it's more like a partially honor system, kind of. So they define the rules and regulations, they make sure that we hold ourselves accountable and follow the processes.
And the question was whether a startup comes to you and they have an authority to operate from the US federal government as a result of HIPAA and FISMA compliance. Is that a factor? Is that a positive factor? No.
No, there is no such requirement.
No such
have you got this license to be a startup in healthcare?
Yeah.
When you are a startup in healthcare, you have to follow certain guidelines, and then you'll have access to the data. But generally, when you are a startup, you don't even need, especially in the current world when we can produce synthetic data. We work with the synthetic data, we don't have any real life data. Yeah. But you don't have to have a license to operate as a startup in healthcare.
So I know...
Unless you are in the device business, which is totally different.
Right.
Then the FDA comes in and it's a different...
Probably a longer conversation.
Yeah, exactly.
I'm going to give up.
One more question. Do one more.
Maybe last question, and then we'll move on because we have to get done.
Okay, hi. So I think you guys are trying to go into AI to reduce costs and all that, and all the failed attempts in the past. But I would invite you all to work with the state and federal government to look at the other AI, which is called Ayurvedic intelligence. So this Western system is 150 years old, and that is 5,000. And there are many cases I myself found better and cheaper solutions going in Ayurveda. So you need to come up with a system in where you take the ideas and do the studies so that you guys have better trust, and then dole it out to the world. And that you'll reduce your healthcare costs, increase your longevity, and not only rely on technology for that, because this medical technology has been sitting for 5,000 years. So you really need to marry it a little better. So you need to think from that angle.
No, it's interesting you bring that up because like turmeric, right? Turmeric is anti-inflammatory, but we don't know much more than that, like how, what is the active ingredient, etc. A lot of Ayurvedic products, we don't know the active ingredient, and Western medicine is all evidence-based medicine. So it's very, very difficult to reconcile the two. That works, this works. We need to figure out, but if anybody wants to add something.
I mean, I think this is the tension between health and well-being and healthcare. And I agree, we need to do a better job of focusing on our North Star being health and well-being of all of us, all of our populations. There's many pathways to that. Healthcare sometimes is very often a help in acute situations, but also sometimes has detrimental aspects. So I think a focus on these technologies or insights that have been around for a long time are also important.
So I know we are almost out of time, and I know you have a question, but we will take it off stage if that's okay with you. You can just stay there. But I just wanted to ask one last question of our panel over here, and it's kind of like a rapid fire question on AI. I mean, imagine that we are going into the future 10 years down. What transformation would you think Gen AI would be able to bring about in healthcare that you think would become a reality or a possibility? Do we, just one word or a few word answers?
We've heard about agentic AI, I think AI clinician.
AI clinician.
I'll say old is new. We want to get the doctor, the nurses back talking to their patients, speaking with their patients, spending time with their patients, exactly what we were doing 20, 30, 40 years ago.
More pajama time, less time with the computer. Yeah.
10 years from now, I see most of the business functions, back office and marketing, completely out of healthcare as a service, and which means that those CX jobs probably won't even exist.
Yeah, to see 10 years ahead, we have to look 10 years back. The adoption of the EMRs 10 years ago was really about 37%. Now it's 96% in the inpatient world, about 87% in the outpatient. So that transformation happened with the external factors like regulations since after the SCA especially. So in 10 years, I see that there will be regulations which will automate a lot of functions to reduce not only reduce the cost, but also provide some additional support to the healthcare providers. We talked about ambient technology. I see ambient being the norm 10 years from now, and we will not, the EMRs as we know them now will not exist.
Thank you, thank you. And I know we are just between you and your coffee over there, so I want to say thank you to all my panelists over here who really made this very exciting and interesting for us. And thank you to the audience for your questions and for your attention and being here. I also wanted to point out Aryan, who's like somebody who supports IIT Bay Area, I don't think he's here today, is the one who was the brainchild behind this panel over here. So thank you for him, and thank you to the IIT for providing this platform for all of us to come here, to educate, to learn, to network, and to provide insights. So thank you, everyone. And I know that there's coffee waiting for people out there, so it's coffee break. Happy to take any questions off stage.